Do you know that gallbladder removal is relatively common during and after pregnancy? The interplay between our body system can be very sophisticated. Another common issue where newly moms experience is these postpartum depressions, also known as the baby blues. In this video, I'm going to discuss about a gene called PEMT, its main function, and how different pathways can be affected when this PEMT becomes dirty. The main function of this PEMT is to make phosphatidylcholine, and is the major component of the phospholipid found in our cell membrane and bowel synthesis. During pregnancy, the mother's body needs to make tons of cell membrane. When phosphatidylcholine is directed to make cell membranes, less is now available for the production of your bowel, especially when you do not consume enough choline in your diet. When that happens, your bowel becomes thicker, making the bowel harder to flow out of the bowel duct. Then when your bowel duct is being blocked, that's when various gallbladder symptoms occurs. But before it gets to the advanced stages and get blocked, the reduced bowel flow can affect the breakdown of large fat globules. Then it can cause malabsorption of your fat-soluble vitamins such as your A, D, E, and K. And since bowel salt in bowel has these bactericidal properties, it can help to prevent bacteria from proliferating and making its way to the small intestines, causing this small intestines bacterial overgrowth. In SIBO, excess bacteria can consume our bowel acids, which can then cause a vicious cycle of the reductions of your bowel productions. SIBO can also interfere digestion of your protein, carbohydrates, and micronutrients, such as your minerals and vitamins. Then deficiency in all these micronutrients can cause a reduction of your stomach acids. Furthermore, reduced bowel flow can also lead to an increase of your cholesterol, because the liver relies on bowel to eliminate excess cholesterol in our body. When the bowel flows sluggishly, the body struggles to process and excrete them out. Then it will cause a buildup in our bloodstream. This can also increase the risk of gallstones, also known as cholesterol stones. Eventually, when you reach the limit, the removal of your gallbladder will be your last resort. Next will be these postpartum depressions. When your digestion of your protein and carbohydrates is being affected, that's when your body is not making enough of these brain chemicals. Tyrosine and tryptophan are essentials for the production of your neurotransmitters. When the productions of your brain chemicals are being slow, now your body has low level of serotonin and dopamine. That's also explain why you have all these depressions, low mood, and sleep issues. Tryptophan in pregnancy can also be depleted because the body is promoting immune tolerance and helps to prevent autoimmunity. It helps to prevent the mother's body from rejecting the fetus. But this can also suppress the immune system too much and further deplete serotonin, causing increased pain sensitivity and postpartum depressions. Even when you consume sufficient protein and carbohydrates, and is able to produce all these neurotransmitters, you may have a leaky cell membrane from reduced phosphatidylcholine. The leaky cell membrane can lead to poor protein receptors, and in layman terms, it means that you can't actually activate them and use them. Another area is stress. Stress can consume a lot of your choline, tryptophan, and tyrosine, because stress triggers the release of stress hormone, epinephrine and norepinephrine, and choline is involved in the synthesis of these two hormones. Stress can slow down your digestion, as mentioned in my past videos, because your body is constantly in the fight and flight mode. But you see, stress can also indirectly comes from the reduced brain chemicals that your body is unable to produce them, such as your poor sleep, social anxiety disorder, or irritability. So let's go over some of the possible solutions and supports which can help to improve the situations. You can eat a folate and choline-rich diet, which helps to clean up the pathways. High choline can also serve as an emergency route for your methylation cycle. Reduce your stress level by removing foods that are most likely to cause stress to your liver. You can strengthen your digestion by providing some additional digestive enzyme. And at the same time, it can also help to heal your leaky gut. You may also want to avoid all ultra-processed food that are fortified with folic acids, colorings, and additives. You may also want to include some light exercises and expose yourself to this daily sunshine, because vitamin D can help with the production of your serotonin. And if you have difficulty in fulfilling the above solutions, you may want to consider to supplement your body with phosphatidylcholine, folic acid, and metafolate. always remember food comes first. If your food can't give you the nutrients that your body requires, then you can go for the supplements route. Okay, we have come to the end of this video. Next time, if you feel a sudden pain near your upper right quadrant of your abdomen, you may want to consider going through the list on how you can support your PEMT gene. If you have not watched the video on how to take care of your cell membrane, do click here